Dr. Robert Tozy here with That's Not Physical Therapy, and today I'm going to show you how to treat your trigger points on your own at home with either a tennis ball or a small inflatable ball. So for today's example, we're going to be treating trigger points in the hip, which is really common for my patients who have either hip pain or back pain, but this really works anywhere if you have trigger points in the quads, in your shoulders or chest, back, doesn't matter. In this instance, we have identified the trigger point for me, which is in the left hip. And what I'm going to do is I'm going to lay on a firm surface like the floor. And I'm just going to put a little bit of my body weight through the trigger point to begin with. This is important to remember, especially for somebody who has a really tender or hot spot. They're not going to be able to tolerate a whole lot of pressure. So I'm maybe putting 5 or 10% of my body weight through this tennis ball right now. And I'm just going to lay here. And over the course of the next couple of minutes, as that trigger point starts to relax and calm down, I can start to shift more of my body weight onto the tennis ball to increase that pressure and decrease that trigger point. I can roll around on it and continue to hit other trigger points or tight, tender spots in my hip as I see fit. You can spend some time here, spending as much as 5 minutes, 10 minutes, depending on what you can tolerate and what your schedule allows. More is more. The more time we put pressure through this trigger point, the more opportunity we have to get it to go away. And that's really the secret to treating a trigger point. Just getting a tennis ball or a small inflatable ball, putting pressure on it and sustaining that pressure over the course of time. I hope this helps.